Health Committee meeting to order for the May meeting. Would you stand for our invocation? Father, thank you for today. Thank you for the gift of another day, and we pray as we deliberate issues before us that everything that we say and do would be pleasing to you and honorable to you. In Jesus' name, amen. Shelley, roll call, please.
Yes, sir. Mike Dobbins.
Here.
Dora Petskowski.
Here.
Sasha Black Fox Qualls.
Here.
Danny Callison.
Here.
Julia Coates.
Here.
Joe Deere. Kevin Easley. Lisa Hall.
Here.
Johnny Kidwell.
Here.
Daryl Legg.
Here.
Kendra McGady.
Here.
Cody Poindexter. Joshua Sam.
Here.
Mike Shambaugh. Movana Shot Pouch. E.O. Smith.
Here.
Kendessa Teehee. We have a quorum.
Thank you, Shelley. On to reports. We met Mr. Deckard last month. He's filling in for George. All right. Thank you, Speaker. I would entertain a motion to approve the minutes if you've had a chance to. All those in favor?
Aye.
Sounds like it passed. Thank you. On to reports, Mr. Deckard, could you come? And we met him last month. He's come to give the Claremore Service Unit the report from there. Thank you, Tony.
Not a problem. Good afternoon. Thank you for having me. I hope everyone had a wonderful Mother's Day weekend. My name is Tony Deckard. I'm the Chief Operating Officer at Claremore Indian Hospital. As reported last month, Commander Carl Murray, he has moved to Pawnee. He's the new CEO at Pawnee, which is a well-deserved promotion and accomplishment for him. So, we wish him well. Best of luck. Downside to that, looks like you got me going forward. So, but I'm here to help you the best I can. In fact, last week I sent an email out to everybody, or I believe it was everybody, kind of introducing myself. If you didn't receive that email, if you would catch me after the meeting, and I'll get your contact information so that we can get we can stay in contact. As always, you should have a copy of the Claremore report in your binder. Do we have any questions on that report before I share a few updates?
Any questions at this point? Danny?
Yes, sir. Thank you for coming today. Every time you give your third-party revenue on page 4 of the report, this is probably a stupid question, but do you guys ever do how much it cost you? So you kind of see the breakdown of how much it's cost you to run your hospital compared to what you're getting off of your third-party revenue?
Yeah. And you have to forgive me. I mean, I looked at the report before now. Right. Obviously, this is my first time coming, and I'm more than happy to make, any changes, additions to the report as, but I know that, yeah, there is a cost breakdown. We do look at that. We do evaluate that for the financial side. Yes, sir.
Thank you.
No problem.
Okay, you can proceed on if you want to, Tony.
Thank you, sir. Just three updates here. I really wanted to point out. In April, Claremore, our laboratory went through the College of American Pathologists, or CAP is what we call it. The CAP inspection is an accreditation organization that evaluates testing laboratories every 2 years. So they focus on lab technologies as well as accuracy and precision of operations. Every time we have this, our lab department's amazing. They receive high praise, and that was no different this time. In April, we also installed a new endoscopy drying cabinet in our central sterile. So this cabinet supports improved processing practices that allows unilateral flow of the equipment from a dirty to a clean environment. This was identified as a best practice. It helps for our scopes to prolong the lives of them. This is identified as an opportunity last year. It just got completed. It was but we're happy to see the project done. So very, very good. And I think Cherokee Nation's actually installing one now or getting ready to as well. So it's a great cabinet. Some of you all may know on April 29th, we had the big storm that come through, really hit Claremore hard, the west side of Claremore, about 7 o'clock in the morning. So there was like 8 power poles down that we were aware of, but there was widespread power outage on the west side of the hospital, or west side of town. We had to go to OB, go on OB, OR, admissions divert. But when that happens, we're used to it. There's some, we have some issues with the infrastructure and things of that nature. But the reason I point this out, whenever the power goes out at our house, we go out on the porch or go find a shade tree, or we go to a family member's house and hang out while we're waiting on our power to be restored, right? And at the hospital, it's totally different. We have different departments depending on where you're at. They go into action, monitoring temperature and humidity in different areas and things of that nature. They don't get to sit around and wait till the boss tells them to go home and enjoy the day. So, and that's more of it. Every time these things happen, it's our staff. They mobilize. They take action. And we were out without power. We have power to our critical, infrastructure, if you will, but it don't cover the entire hospital. So our staff went into action, took care of that, and this is just more or less to brag on them, how they continue to, to surprise us every time and take care of our hospital. So it's a big kudos to them. So that's all I have today. Anybody have any questions?
Questions for Tony? Chief?
So you have backup generators, but it's limited on what they can power?
Correct. Yes, we have a backup generator. It powers our critical and life safety branch of the hospital. So, we still have lights and it still takes care of, and don't get me lying to you exactly what areas of the department, but it does take care of our critical, our OR, PACU, things of that nature. It takes care of that. And we also, and we still have AC. It runs some of our AC in the hospital, but there are certain departments that do not have that, will not have a temperature, or, controlled environment, if you will, have AC or heater.
So your pharmacy probably is one of them that does?
They're good, yes.
Okay.
Yeah.
Has there ever been plans to maybe upgrade
Yes.
that, or just it would cover those areas that you're having problems with when the power goes out?
Yes, sir. Yes, sir. We have a project now, and they've been working on it for over the past year and a half or so. Very complex, going to be a very lengthy project. Again, it's a hospital built in the 70s.
Yep, it is.
And things have changed a lot over,
Absolutely.
the past 50 years here. So getting that one line diagram, understanding the electrical components, how everything's ran to support it, that's what they're going through, figured out now. Also to determine, what the load is, what we'll have to provide, what kind of electricity we'll demand from that generator. So, yeah, no, there is something underway as we speak.
So just hypothetical,
Yes, sir.
is this, with the upgrades it needs, this hospital needs, would it be more feasible is it functional in today's age? Without dumping just a ton of money in it? I know you probably need a lot of things, but would that be feasible, or would it just be a new building and be more feasible than that?
That's a great
Hypothetical.
question. Hypothetical. I'm not, I don't know that qualified to answer that, but from my opinion, just looking at research, I've looked at this, online and talking about, old infrastructure, hospitals, things of that nature that are coming up on their 50-year mark. And we're not unique there.
Sure.
That's across, across the United States here. And It would cost a lot of money. I mean, there's a lot of, issues,
Just best case scenario would probably just be to start over probably and build another one.
Yeah, I mean, obviously, that's
Yeah,
what I would
obviously,
want.
that would be the
Right,
best way.
That's what I would want.
Yeah.
But again, I don't know that I'm qualified, if
Sure.
you will. There's significant costs associated with the
Absolutely.
hospital.
And one more real quick.
Yes, sir.
Back to Councilman Callison's question, what you bring in to, what it costs and covering that expense. Maybe that's a question we will ask you off camera.
Okay.
We will try to know if what you're bringing in is covering the cost of running your facility.
Okay.
We'll just speak with you off camera after it's over.
Sounds great.
All right, thank you.
All right.
Okay. I see none. Thank you,
All
Tony.
right. Thank you guys for having me. Thank you.
Up next is Cherokee Nation Health Services, and I see Mr. Brian Hale is pinch hitting for Dr. Jones.
Good afternoon. Thank you all for this opportunity. I believe you all have a copy of our report to the Health Committee in your packet. I'm happy to try to answer any questions that you have. I would also like to, we had our physician med gala on Saturday night there at the Hard Rock, and just on behalf of everyone in health leadership and within health services, express our appreciation for being able to do that, and also say thank you to all of you that were able to make it. We had a really good night, recognizing the service and the contributions of all of our physicians and providers. Also, happy to tell you all that we were recently the recipients of an award from the Oklahoma Quality Foundation. We got the Achievement of Excellence Award in recognition for our work on just trying to continually improve the care and services that we provide within Cherokee Nation Health Services. So wanted to let you all know about those two very positive things, and happy to try and answer any questions that you have.
Questions for Brian? Johnny?
Thank you, Mr. Chair. Sir, thank you for coming in today and filling in. Always great to hear from the healthcare folks about all the great things going on. I've got a real quick question for you. By chance, do you have the list of the working group or task force folks that were assigned when we did the memo signing back in February to look into the dialysis and the telehealth and the Medicare premium assistance and all that stuff?
I don't have the list with me, but I can get it to you.
Okay, that'd be great. I just want to kind of take a look, see. I know that that's supposed to report out July 1st, if I'm not mistaken. I know we're all anxiously awaiting the outcome of that. Just wanted to put that back on the front burner for you there.
Okay.
Thank you.
Anybody else? Sasha?
Thank you, Chair. Thank you for being here with us. With the prevalence of alpha-gal going around, are we doing anything as far as treatment-wise within our health system to combat that or to treat?
So I'm not aware as far as exactly what we're doing on the way of treatment, but I do know that we have some specialists that we refer patients out to, and they can do the testing and set up a treatment plan for those folks.
So we are doing referrals for
Yes.
outside? Okay, thank you.
Anyone else? Thank you, Brian.
All right, thank you all.
Okay, and then from Public Health, we have Ms. Lisa Pivek.
CO, it's good to see all of you today. I'm glad to be here on a beautiful day. You have our report in front of you. We have a lot of activity going on right now within public health. You can see, if you look at your own individual districts, you'll see lots of community-based projects going on, as well as the wellness spaces. They continue to gain members, both Marble City and Kenwood, and functioning really well. We're really pleased with that. So, and we're also administering several new programs, as you might see. Some of them revised, some of them new. And you've probably seen about some of them in the news, and I've probably had several of you on the phone discussing it. But we now are operating summer electronic benefit transfer, WIC Farmers Market, the addition to WIC Farmers Market for Cherokee citizens, and now a senior farmers market. And so the senior farmers market was just publicized last week, introduced, and since that time we've already had close to 425, I believe, sign up, and we anticipate quite a few more. All the eligibility guidelines are on the website and in the article. And of course, if you have any questions about any of those, I'm happy to help you. Since it's our first year doing it, we know we're going to be working through some things, but we're really excited. We've had a great response so far. And our team will be going out to the farmers markets that are existing on Saturdays to get more people signed up. They're also going to the nutrition sites across the reservation to get more folks signed up, as well as recruiting our community health workers to go out and ensure more folks get signed up. So with that, I'll be happy to answer any questions.
Really, a comment first. That's a very good thing that you're doing because, especially with Kenwood and Marble City and different places, that gives opportunities to people that didn't have those opportunities. And that is such a big deal when we can reach out to people that we haven't been able to touch before and, make sure that they have the same opportunities that others have. I'd like to say that's an outstanding program that you guys are doing. You're doing a great job. And I apologize if I missed the email, but if there was an email, do you have a list of those places where the farmers markets are and the times? I would really be interested in that. That's a great deal too. I so look forward to the summertime when you can have stuff out of the garden. It's so much better, but I would really be interested in that information. If you could get it, if you haven't, could you get it to Gail and she could, distribute it to all of us? That would be great.
Okay, great. Yes, and we're working on a map that's going to be placed on our webpage. The sites are listed on the webpage, but there's also going to be a map, and we are experimenting with doing some of those markets, like we had one at Marble City to get the local farmers in. Our WIC team and our farmers market team can get the farmers up to date. It's pretty easy to do on their phones, and try to have more markets at different times so people can get to those across the reservation.
Well, if you could distribute that to
Yeah,
Gail,
I
that
sure
would
will.
be great. All right, thank you,
Thank
ma'am.
you.
Thanks, Chair.
Cody?
Hi, Lisa. I had a constituent on the farmer's market deal. She was having some technical difficulties. I think she said the link was freezing up. Can I just direct her to you?
Absolutely. We had another one, similar situation on Friday, and we
Okay.
hooked him up and got him signed
All
up
right.
that day. Yeah.
Good deal. And I just wanted to compliment your staff for the Run for the Berries 5K at Stillwell. I thought that was one of the coolest things to participate in and be a part of. That was my first ever 5K, so I didn't know what to expect, so I'm still hurting today. But
Good for you.
and
Good.
I asked them, and they said they had over 500 participants. They
Yes.
said that's one of their largest ones that they do, and it was really neat to see so many Native people just being active.
Yeah,
that was really cool.
That's an amazing race, and we are working in our WINGS program. I didn't mention this, but we have a group that's working now, a quality improvement group, to see how many more people we can get in person at races. We're still going to maintain the virtual option for others, but hoping to get more families and people out in person. So thank you for that.
Daryl?
Lisa, I've reached out to Jennifer Kirby. She hadn't answered me back yet, but I had someone said if we receive the monies for the farmers market, would that affect their income level on receiving commodities?
No, no, absolutely not.
Okay.
Actually, they're already eligible. They have what's called adjunctive eligibility. If they're on Medicaid, if they're on SNAP, if they're on FDIPA, or any of those programs, they're automatically eligible.
Kendra?
Lisa, would you mind hanging around for just a few minutes afterwards? I want to ask you a question.
Absolutely.
Thank you.
Danny?
Yes, I just want to tell you that I was at Inola. I think they received your first, your public health and wellness grant
Yes.
with their Little League softball and baseball fields. So they were really excited. It's a good thing, and it's really going to be put to use. So thank you all very much for coming up with that.
Yeah, glad to see more people getting outside and getting together as families and getting some movement. Yeah.
Okay. Anyone else? Thank you, Lisa.
All right. Thank you.
Okay. Old business, none pending. New business, none pending. Announcements. The next meeting is tentatively scheduled for Monday, June 16th at 1. Are there any other announcements that we need to make? Okay, need one more motion. All those in favor of adjourning? Opposed? Motion passes. We are adjourned.